For the Lockman, you're going to want to provide an anterior translation of the tibia against the femur. What you're doing is holding the femur in place with your hand and pulling with your distal hand on the tibia, feeling for an end range catch.
It's important to note that this exam should be done with the leg in about 20 to 30 degrees of flexion to prevent the knee locking mechanism from providing that catch or preventing any translation. Grading the Lockman uses translation distance or a judgment. I prefer the judgment because it's hard to tell exactly how far the tibia translates relative to the femur. For a grade 0, you're looking for a normal tight end catch with a firm feel. For a grade 1, that is a symmetric but normal increase in laxity, and this would be the same on both sides. Or you see one slight increase in anterior translation compared to the contralateral knee. If the laxity is symmetric, then it's more related to the patient's general laxity rather than specific pathology of the ACL. If there is asymmetry in the laxity, that suggests that you have a low-grade injury to that ACL. A grade 2, you see excessive anterior translation of the tibia compared to the contralateral knee. And in grade 3, it's an absent or ill-defined endpoint, where you don't really feel that end catch. And that's significant for a complete tear. Here you see a firm catch, grade 0 ACL.
You can also test the ACL by doing an anterior drawer. You want the knee at roughly 80-90 degrees of flexion. You sit on the toes, 4 foot, and you pull
On the tibia.
Feeling for anterior translation of the tibia relative to the femur. To test the PCL, you maintain this position and you push against the tibia, feeling for posterior translation of the tibia against the femur.
The anterior and posterior drawer are graded the same way as the Lockman.